there's a number of things that nurses can really do in this space, and that is starting with understanding the risk factors around this disease and really making sure that the patients that they care for, understand these risk factors. We offer certainly a number of resources that help make that education effective for individuals, whether they come to us through getscreen.org, and really they can take our screening quiz and understand what their risk factors or recommended screening, have a recommended screening recommendation made for them. Nurses can also utilize the screening quiz to help foster the education and awareness around screening, but really talking about those risk factors such as family history, a history with Lynch syndromes, Crohn's disease, type 2 diabetes, understanding other risk factors that are have to do with race. When we're talking about Alaska Natives who have the highest rate of colorectal cancer incident and death, and then with Black Americans who are 35% more likely to die from colorectal cancer and 15% more likely to develop than their non-Hispanic white counterparts. And so really understanding these symptoms and then helping patients, understanding these risks, and then helping patients understand their risk factors. There are some other really practical things that can be done as well. Dr. John Marshall from MedStar University talks about nurses and how they can help coach and push patients to their, and the physicians as well. So not just patients, right? And when we're talking about improving behaviors around screening, physicians, along with steps that are needed to get screened, nurses can help identify symptoms like gastrointestinal bleeding, abdominal upset, unexplained weight loss or changes in stool and habits. And they can counsel patients around screening and the importance of getting screened, but also understanding their screening modality. So if we're talking about someone that is average risk, a lot of times a barrier to screening is people's fear of colonoscopies. But if we're talking about someone who is considered to be average risk, then a screening option for them is a non-invasive screening modality. And that is something like a stool test that can be taken home, a Cologuard test, or a FIT test that can be taken home. And it's really one that helps to address some of those fears around going through the prep and the process of a colonoscopy. Nurses can also support reminder protocol. They can do things like birthday reminders that can be set up in an EHR system so that when someone becomes, eligible for screening, that there's an alert that's created. And so when that patient's being seen, they can be reminded that they are due to be screened. The Community Preventative Services Task Force also offers a number of evidence-based recommendations and interventions for nurses that can help to execute such opportunities as one-on-one education or client reminder or client incentives. And those are all things that nurses, but I will say not just nurses, like we can really look at a practice and look at who engages with patients, that there's an opportunity to have this kind of education and dialogue to create that awareness around screening. Nurses can also support patient navigation for follow-up colonoscopies and connecting patients with community resources, such as those offered by the Alliance. If a person, for example, is experiencing a barrier such as financial insecurity. But going back to the opportunity for really utilizing nurses to help with patient navigation, there's an opportunity there to help close gaps to colonoscopies. So for example, if we're going back to individuals that are average risk, perhaps they've taken an at-home test and that test result is positive, which means that they would then need a follow-up colonoscopy. Some of the work that we do as an organization and in the work that I lead is to help work with partners in ways to help reduce that wait time for colonoscopies. And nurses can play a really vital role in helping to assist with patient navigation to help close that screening gap from positive FIT or Cologuard to colonoscopy. So there's a number of ways that patients can really, that nurses can really help. One of the things, just kind of going back to what physicians, clinicians, nurses can do, they can also inform patients and caregivers of the resources that the Colorectal Cancer Alliance makes available. The Alliance offers a number of critical resources for patients and caregivers, starting with our helpline. And so people can reach us at that helpline at 877-422-3040 for free professional assistance with live certified patient navigators who can help with financial assistance, help connecting with peer groups, and so much more. We also have programs that we really want to make sure that providers and clinicians and nurses are aware of, such as Blue HQ, which is a unique online support hub that connects patients and caregivers with personalized resources, including useful tools to help navigate diagnosis and treatment for better outcomes. There's also programs like our Buddy program and our Young Onset Support Group, and our financial assistant program through our Blue Hope treatment program, which helps to provide patients with a one-time financial stipend to help with daily expenses around the burden of treatment, and including childcare and transportation. And we also have a partnership with Cottonelle Black Health that helps to, through this partnership, helps to provide assistance with covering colonoscopies for Black individuals who have financial insecurities and aren't able to have access to that level of care.